So, this is Vic, Dr. Montgomery. Okay. So, the first question is, how did you find out about FMS?
Okay, so functional movement assessment, I learned that through my PhD program that I'm going through right now. Dr. Plinsky, one of the co-authors or one of the leading researchers in that area, he actually introduced it to us. Actually, they're really trying to get PhD students and everyone to kind of contribute to the research in this area, and just basically change up the way we assess the human body. At first, I was kind of skeptical about the whole idea, because I was actually the first assessment tool that I used was through the National Academy of Sports Medicine, and I'm certified in corrective exercise. So when I learned that technique, I was kind of going by that a lot more. And then I was kind of, being biased about the FMS. But now that I use it and I've integrated it in my own clinical practice, it's been real beneficial. And so it's basically a real efficient way to assess an athlete.
So, so through your PhD program is where you met
Yes.
Plinsky, and you said that he's like one of the co-authors, right?
Yes, he's one of the leading researchers in this area, and he's doing a lot of research in ACL prevention, and then recently he's been doing a lot of stuff for upper body injury prevention. So he's basically, again, trying to develop research and basically validate this whole assessment technique.
So if you had the resources, would you use it for PPEs?
Yes, I would definitely use it for my PPEs. I think that would be real beneficial. If I had the resources, and the manpower, I would have one for every athlete, and then that will really give us a good idea of where they're at, and then implement a preventive program right away. And I'm sure, anecdotally, it would be a lot of injuries that we would be preventing.
What sports do you think would benefit mostly from, or would you say all sports?
All sports. Yeah, I can't really, because I've already implemented it for all the sports I have here: basketball, football, track, for everything, and it seems to work. So I wouldn't limit it to just one type of sport. It works for everyone.
Let's see. So you kind of said already that you do believe it's an effective tool. My next question would be, do you believe it's an effective tool for predicting lower extremity injuries? So kind of already said that.
Yes, because what it does, I use it, a short version of it. Just to see where their movement is at. But you can even take it a step further and do wide balance testing, when you're checking to see how far they can, when they bounce on one leg, and you see how far they reach at 3 different angles, and then you can get a measurement for that. There's ASFMA. That's another assessment. There's two different. There's two different areas. There's one that's only used by healthcare providers, and there's one used by, another assessment that's used by healthcare personal trainers. So I think it's effective. It's just the research isn't there yet, but I think it's going to be the latest way to assess athletes, as opposed to doing the uniplanar or like the manual muscle testing and all that stuff, goniometer. That's also integrated in FMS, but we have to change from the uniplanar stuff to more functional type of movement assessment. So I think that'll be the new wave of doing our job.
So you think it kind of gives you more of an accurate description of what they are lacking, rather than just doing goniometer, like if they're lacking 10 degrees or whatever?
Yes, because when you do those assessments, you may find something significant clinically, but how are you going to translate that information into their movement to their activity, and so basically, all those manual muscle testing, yeah, they may be clinically, useful here, but how do they translate onto the field, and into their movement? So basically, we're trying to get close to mimic their movement or their sport-specific movement as close as possible, and I think functional movements are going to help with that.
Something that I talked to Dr. Montgomery about was, she said there's a difference between dysfunctional moving, because people who have dysfunctional movements sometimes don't get hurt.
Yes,
they
exactly.
move really weird, but they don't get hurt.
Yes.
So do you think seeing their form of dysfunction, how do you differentiate between dysfunction and they're gonna be okay, and no, they have a real problem, we need to implement a program for them?
So the two branches of dysfunction and FMS is basically if you have a motor control issue or you have a stability issue. Okay, motor control means that you don't really know how to work those muscles properly, and then if you teach them how to work those muscles properly, then they're good. But if they have a stability problem, that means they don't know how to use those muscles, but they also have basically a weakness. I'm not a expert in this area yet, but I know when it's a motor control issue, you can teach them and they'll get back on their feet right away. But when you have a stability problem, you have a motor control issue, but you also have a major muscle dysfunction, okay, that you need actual treatment on, you need to get them on a foam roller, you need to do some moves on them. I try to stay away from as much hands-on stuff as possible because of all the volume I get in the clinic. So to me, I try to look at it, I try to look at it more as a motor control issue and a motor learning issue. So I try to look at it that way, and then if it takes longer than usual to fix, then I'll put my hands on the athlete.
Right.
But from the efficiency standpoint, that's the way I'm forced to look at it. But of course, I'm not gonna neglect the athlete if it's something significant or something that I feel requires that hands-on treatment. I'm gonna do it. But for efficiency purposes, I'll always look at it from the motor control standpoint.
Well, and also you said you have a lot of people to treat, so it kind of frees up your time, so you can bounce back and forth.
Oh yeah.
That makes sense. Do you think of anything else you'd like to say about it?
I think overall, as a profession, we have to, we have to improve the efficiency of our work, and this is really helping. This type of assessment tools are really important to implement and integrate in our practice. That doesn't mean that we're short. We're not trying to have our athletes. We're still trying to do our job, but we just got to do stuff more effectively and efficiently.
Yeah, you're not trying to neglect the athlete, but you're trying to be more efficient with your time. And
yes, exactly.
You have other people to treat.
Yes, and that goes along with the way that we're trying to change our evidence-based practice. So we're taking the latest research, again, what evidence-based practice means. Latest research, our clinical experience, and then the patient satisfaction. So I found that FMS, as soon as I implement it, they walk out here feeling better. When I used to practice the old-fashioned way with manual muscle testing, they tested weak. The whole manual muscle testing and performing a squat, they had pain. The athletes still walked out of here with pain and not much improvement in their function. So the FMS way to do things, they walk out of here with pain, 50% gone, and then their movement improved drastically, by doing the rolling and stuff like that. So yeah, it's just gonna change the way you treat an athlete. It's gonna make everything more effective.
from what I've seen too, is it's a way for us to see that they have a deficiency, and then for them to see it too.
Yes.
They're noticing like, yeah, my rotation is terrible, so they get to see it. So it's almost it helps like mentally.
Yes.
It gives them something to refer to.
So you do your pre-assessment, and then they'll go through their different movement dysfunctions and try to improve that, and then you have them do your post-test assessment, all those same movements, touching the toes, extension, rotation, and then they'll be able to see that they improved, and psychologically that helps out.
Yeah,
a lot.
they trust too. Like they're like, oh, you know what you're doing.
Yes.
Well, thanks, Nick.
That's about it. Okay. Peace.
Sweet. Bye.